Yesterday, Dr. Alan Garbutt added his name to the growing list of people who have asked for a public inquiry into the culture of fear and intimidation this government perpetuates. Like others, Dr. Garbutt was told to stop advocating or he and his patients would, quote, suffer the consequences, end quote. Interestingly, Dr. Garbutt chose to go public through the official opposition and the media, not the Health Quality Council. To the Minister, given that doctors are raising their concerns publicly about the Tories' bully tactics, will the Minister admit the Health Quality Council cannot guarantee legal protection to doctors who have been intimidated?
The Honourable Minister.
Mr. Speaker, I've answered this question numerous times, and perhaps the Honourable member did not hear the answer, so I'll give it again. The Health Quality Council has embarked on an independent review with very capable, very qualified people involved in the review, plus equally capable people, well-renowned and respected people overseeing it in an advisory capacity. As part of that, they also have assured anyone who wants to come forward the full protection as given under the Alberta Evidence Act.
Well, given that Dr. Garbutt said that only a judicial inquiry will restore his confidence and that of thousands of other professionals and accountability to the healthcare system, how many more times does the Minister need to hear this before he calls a public inquiry?
The Honourable Minister.
Mr. Speaker, everyone is entitled to their opinion, and I hope the Honourable member will afford me mine. We've made it very clear here that the process that we're following is with the Health Quality Council. They're doing an assurance quality review of the very items that were asked in this House regarding the impact of wait times in emergency rooms, regarding access to cancer care, and regarding the issue of relationships with physicians. And nobody is championing that cause more than they are, but I want to add my championship to that as well, because we're encouraging doctors to speak out, and I'm glad that's happening.
The Honourable Leader.
Well, encouraging isn't working because they know the truth, Mr. Minister. Why is the Minister more concerned about letting the scandal die than doing what is right and calling a public inquiry? What are you afraid of?
The Honourable Minister.
Mr. Speaker, I think the process is working very well, and nobody's asking for it to slow down. We're simply saying this review is just starting up, and let's give it a chance to complete itself. There will be a report in 3 months, another one in 6 months, and in 9 months we'll have a report, I'm told, and we'll have some recommendations on how to address and fix whatever problems are found.
Second official opposition main question, the Honourable Leader of the official opposition.
Mr. Speaker, Alberta has the world's finest frontline healthcare staff. Yet under this government, they suffer in a culture of fear and intimidation. Dr. Paul Parks, again today, with the AMA Emergency Medical Section, supports the Health Quality Council on ER wait times and outcomes, not on issues of threat and intimidation. The only solution, as Parks said, is for a public inquiry, quote, to ensure a similar culture of intimidation and punishment of patient advocates never occurs again, end quote. When will the Minister listen to the thousands of doctors and others? Find your backbone and call a public inquiry.
The Honourable Minister.
Mr. Speaker, I met with Dr. Paul Parks and Dr. Sobelman just a couple of nights ago. We had a very thorough, let's call it robust, discussion on emergency wait times, and even they acknowledged that significant improvements have been made. And I'll tell you where the improvements have been made. We've reduced the overall length of stay in emergency departments by as much as 50%. We've also reduced, that's tremendously good news. Thank you. We've also seen reductions of up to 60% in the number of EIPs. To explain again, emergency inpatients. And those are two very significant improvements. I've acknowledged we need to do a little bit more on the 4-hour and the 8-hour, and we're working on that as well.
The Honourable Leader.
Divert, deny. Given that it's the frontline staff who demand a public inquiry, which friends and senior officials is this Minister trying to protect?
The Honourable.
Who are you protecting, Mr. Minister?
Mr. Speaker, sometimes you have to protect people in this House from accusations just like that. And I'll stand here and defend people who are out after the better health outcomes, which is what doctors are all pledged to do. And that's why today Alberta Health Services invested an additional $190 million specifically for emergency departments, who will get $19 million of that. $15 million will go to the radiation therapy speed-ups that are needed. $46 million will go to reduce surgical wait times in areas like cardiac and cancer surgery, and $110 million will go to reduce the number of patients who are in acute care hospitals waiting for continuing care spaces. Tremendous news.
Honourable Leader.
Don't throw money at it. Fix it.
Throwing money at the problem, I'm sorry, Mr. Minister, will not restore confidence in the system. Given that the president of the ER doc says that the culture of intimidation has not changed in 6 years, when are you going to stop covering up this scandal?
The Honourable Minister.
Mr. Speaker, nobody's covering up anything. In fact, quite the opposite would be true. What we're saying is if you have an issue that you want to raise, please come forward. You'll be given confidentiality protection, you'll be given immunity protection, and you'll be given full protection against any creation of any liability under the Alberta Evidence Act. So, in fact, we're doing exactly the opposite of what he's accusing us of doing.